I would like to discuss the nutrition, hydration, immune support, and detoxification protocol that I use personally on a daily basis, but also recommend to all of our surgery patients, particularly the breast implant illness women. And this is a way that kind of helps build the body and prepare it for the surgery. The first several breast implant illness explantations that I did, the ladies were very, very ill. And we made it through surgery. However, they really struggled the first several weeks to a month or two afterwards. And as I looked at them struggling, I thought, what can we do to help them so it's not as much of a recovery? And what I basically determined was, why don't I do and recommend to them what I do on a daily basis? And that's to build up nutrition, as we talked about in the second video, to balance that scale for health and toxicities. So build up the nutrition, help with hydration because we need fluid inside the cell, and boost our immune system that has been taxed and overrun, and then help with detoxification. And there's multiple ways to do this. Now at this point I'm speaking more from the health optimization coaching certification, nutritional counseling certification, and essential oils that I have done through my training in the last 10 years to understand how to more naturally build the body. And again, you build the body, it will heal. The first thing that I always talk about is Moringa oleifera. Now this is a tree that's been on the earth for over 6,000 years and grows within about 10 degrees of the equator. Now there are 58 different varietals in the world, but I consume the most nutrient dense. And it's in the form of supermix. And this is what I now use as my daily vitamin. As a matter of fact, I feel that I would have been forced to retire from plastic surgery about 12 years ago because of psoriatic arthritis that was involving my hands and fingers. I tried traditional medical therapy and nothing was working. I ended up getting gastritis from the anti-inflammatories, and then had 3 injections of steroids into my knuckles over a period of 1.5 years. Things weren't getting better. And somebody told me about this with the 36 naturally occurring anti-inflammatories, but all the other nutrients in it. I then consumed it within 4 weeks. My hands felt better. Within 4 months of daily consumption, I was off medications. What that taught me was, if I feed my body, give it what it needs, it will heal itself. So that's when I got my nutritional counselor certification, is to understand nutrition more. Now another nutrient that we oftentimes hear about but really don't think is a nutrient is water. And our bodies are made up of about 70-75% water. But where we need that water is in the cells, or intracellular, not extracellular. When it's outside the cell or extracellular, that's inflammation, that's weight gain. We need it inside the cell for all the biological and physiological chemical reactions that occur. And there's a way that has been scientifically documented how this happens, and it's called MRET, M-R-E-T, which stands for Magnetic Resonance Effect Technology. What MRET does is restructures the shape of the water. So if we remember back in Chemistry 101 in high school, water is H2O, 2 hydrogen ions and 1 oxygen ion fused together. But the oxygen was always up here and the hydrogens were always down at the bottom. And so it takes this tetrahedral or triangular shape and it's kind of bulky. The way water gets into our cell is through a single water molecule wide channel called an aquaporin. Now if the molecule is triangular or tetrahedral, it's kind of bulky and doesn't get through as well. But if we were able to restructure and get those hydrogen ions on either side of the oxygen, it becomes more linear and can flow into the cell 3 times more effectively, and that's what the studies have shown. So using an MRET, let me grab to show you what this is. It's actually just a plastic pitcher with this little machine. I don't have the electrical cord that plugs into the side, and it just goes into a normal 110 volt wall outlet. You hit the button on top, that blinks red for about 30 minutes, and within 30 minutes the water is now restructured and will maintain that for about 90 days. The benefits of MRET are that it's a little bit more alkaline, it's the viscoelastic properties change, and just makes a wonderful way to hydrate our intracellular fluid. Speaking of other fluids, other ways then we can help with the immune system are two other types of solutions. The first is a water as well, and it's called ionic colloidal silver water. Now there's some controversy that silver water can cause argyria, which is a process that the silver miners used to have by breathing in the silver salts that would turn their skin permanently bluish gray. So we don't want that. You want it to be ionic, or in the ionic form, and we want it to dissolve and go through the oral mucosa. If it gets down into the stomach, the hydrochloric acid binds it, so you'll want to swish this around your mouth. But the silver water, ionic colloidal silver water, is wonderful. We actually have a machine here at the office that is the replica of the ionic colloidal silver water that's on the International Space Station. So this is a way that we can help get silver, which is one of nature's most potent anti-pathogens. So what a pathogen is some abnormal cell that gets into our body that can possibly cause harm. So the silver will help to the immune system by helping fight off those pathogens. Another type of a solution that helps build up our natural killer cells, or our CD4, CD8 cells, is a formula that a dear friend of mine, Dr. Howard Fisher, helped to create and formulate. He actually was involved with the MRED as well. But the immune response formula is a concoction of multiple plant substances, like substances from mushrooms, turmeric, cruciferous vegetables like broccoli and cauliflower, resveratrol from red grapes. All these have been shown to have highly anti-inflammatory effects, and the combination of this has been shown to help increase our natural killer cells and help boost our immune system. So that gets through the nutrition, hydration, and immune support. What can we then do to help the body naturally detoxify? And several ways to do that. Essential oils. Essential oils, in my opinion, are God's natural given medications. They have inert properties that can affect our bodily systems. Some of the major ones, again, frankincense, known as the king of all essential oils. It has such healing properties. Peppermint oil is great for digestion, headaches, and just kind of clarification. ProShield is a blend that is like Thieves. It is kind of a blend of several different oils that can help really support the immune system, particularly in these trying times with viral issues occurring. And one of my favorites, which is really good for people that are having BII or any other issues, is True Lavender. True Lavender is an oil that, again, is antibacterial. Almost all essential oils are antibacterial, antiviral, antifungal, antiparasitic, some more so than others. But they all have different properties as well. True Lavender is one of those wonderful oils that can really decrease the stress. The cortisol levels decrease, and we know that when we have high cortisol levels, our body is in the fight or flight mechanism and not in the rest and repair mode that we need to kind of restore the body. So True Lavender is something that really helps greatly with that. Another way that we can detoxify, and I just do this kind of once on a weekend, but it's called premium tea. So this is a specially formulated tea that is one of the most detoxifying experiences you will have. You drink it and steep it at night for about 5 to 30 minutes, depending on the results that you would like. And within about 8, 10, 12 hours the following morning, you will have a moving experience. And that experience is like none other you've had before, but you know it's those toxicities coming out. Other ways that we can physically detoxify is a simple process called dry brushing. What dry brushing is using a specially designed brush, and you can get them at all sorts of different stores. but it's a way to do lymphatic massage by using the brush and just going through the lymphatics, and it helps the body continue to move the lymphatics around. One of the last methods is exercise. Now, we all sometimes are too tired to exercise, particularly the BII ladies, that you just are so fatigued you can barely get off the couch, let alone go on a bike ride or a jog. The issue with a bike ride or a jog or a long walk is if you're 2 miles, 3 miles away from home and you're tired, you still have to get home. So there's a process that's called rebounding. What this is actually just jumping on a mini trampoline, and the vertical vibratory motion really helps stimulate the energy in the body. It gets blood flowing through the muscles as well as the lymphatics draining back through the organs of elimination. The nice thing about that is if you get tired, you're not 2 or 3 miles from home. You're 2 or 3 steps from the couch that you can go sit down. The last thing for the detoxification, in my opinion, is to get the implants and the scar capsules out. That inside the body, I think, continues in some ladies, as we've previously discussed, can cause some issues, and so that is the major way that we help detoxify. But reviewing this, I look at the surgery, or any surgery, as almost like an athletic event. Now, we can all go out and get 26.2 miles in today. It might take us 4 hours, it might take us 4 days, and we might be back crying, cursing, and crawling, but we can get it done. But if we train for that event and build the body up and help get the detoxifications down, we're going to do better, perform better, less risk of injury, and quicker recovery. So that is my Aspire protocol for surgery, particularly the breast implant illness ladies. Thank you.